Hi folks, welcome to my channel, The Average Dermadoc. Let's begin the show. Anatomy of urethra. What is urethra? It is a tubulomuscular structure extending from urinary bladder, exactly from the neck of the urinary bladder into which urethra opens till external urethral orifice, exactly at the tip of the glans penis. In males, where it opens to outside, whereas in female it is vestibule, where it opens to outside. Urethra is present in both males and females. What are the difference between a male urethra and a female urethra? Male urethra is long, 20 centimeters approximately, and curved, double curved. Whereas female urethra is short, 4 centimeters, and straight in course. Male urethra passes through prostate and then penis, and then it communicates to exterior at the end. Whereas female urethra is embedded in anterior vaginal wall and opens into vestibule. Here in male urethra, it has two functions. One is urinary function and one is reproductive function, as it allows passage of both urine and semen. Here in female urethra, only urinary function. It allows the passage of urine. Coming to parts of male urethra. Only male urethra has named segments like this. Female urethra doesn't have any named segments. Male urethra is divided mainly into two parts. One is anterior, distal most part. Another one is posterior. P for posterior, P for proximal most part, which is nearer to urinary bladder. From proximal to distal, according to the segment which it passes, it is named. There are 5 named structures. Posterior most, proximal most, nearest to the urinary bladder. First structure is pre-prostatic urethra, then prostatic urethra, and then post-prostatic or membranous urethra, and then bulbar urethra, and finally penile or spongy urethra. We'll see one by one. First, posterior most part nearest to urinary bladder, into which it opens, is pre-prostatic urethra. Here this green color structure which I drew is nothing but cross section of pre-prostatic urethra. It is stellate shaped. It is present in between the neck of the urinary bladder and prostate. Urinary bladder opens into urethra through internal urethral orifice, which is embedded in the wall of the urinary bladder. This entire pre-prostatic urethra is surrounded by internal urethral sphincter. What is meant by a sphincter? It is nothing but a circular muscle which surrounds any tubular structure and controls it opening and closing. Next part, prostatic urethra. By name itself, we can get an idea. It is lying entirely inside the prostate. Its cross section is semilunar in shape. It is most dilatable part because it has many openings in it. Part of the urethra which has in its posterior wall 3 named structures. First, in the middle, it is urethral crest, nothing but a midline ridge or mucosal fold. On top of this urethral crest, there is an elevation where ejaculatory ducts open. What is ejaculatory duct? It is formed by duct of the vas deferens from testis and duct of the seminal vesicle. Seminal vesicle contributes approximately 60 to 70% of volume of semen, and ductus deferens carries sperms from testis seminiferous tubules to ejaculatory duct. Finally, this ejaculatory duct opens into verumontanum or colliculoseminalis, nothing but an elevation on the urethral crust in the prostatic urethra. Here on the urethral crust, prostatic utricle is also present. On either side of this urethral crust, there is a depression called prostatic sinus. By name itself, we can conclude that prostatic ducts opens into this prostatic sinus. Hence, these many openings are there. It is most dilatable part of the urethra. Now coming to part of urethra after prostate. Post-prostatic urethra or membranous urethra. Why it is named membranous urethra? It passes through perineal membrane. Same like pre-prostatic urethra, its cross section is stellate shaped. It is least dilatable part of urethra surrounded by external urethral sphincter. Again here sphincter came. It controls urinary continence. Here external urethral sphincter. Internal urethral sphincter, what it controls, we will see here. Coming to difference between internal and external urethral sphincters. Already we know that internal urethral sphincter surrounds entire pre-prostatic urethra, in which internal urethral orifice is also a part embedded in the urinary bladder. External urethral sphincter surrounds membranous urethra after prostate. Both sphincters we know it is nothing but a circular muscle. Here internal urethral sphincter is a smooth muscle derived from bladder musculature, whereas external urethral sphincter is striated or skeletal muscle derived from sphincter urethrae. Coming to nerve supply, internal urethral sphincter is involuntary in control. Involuntary muscles are supplied by autonomic nervous system. Nothing but here sympathetic T11 to L2. What is the function of internal urethral sphincter? It prevents retrograde ejaculation of semen. Normally semen has to go anterograde to outside of the urethra. Here retrograde ejaculation means if semen goes back into the urinary bladder, it is called retrograde ejaculation. So here it controls retrograde ejaculation as it closes the way to the urinary bladder. External urethral sphincter is voluntary in control. Somatic nervous supply S2, S3 and S4. It controls or maintains urinary continence. Continence means voluntary control of urine. We can control our urine when the bladder is full until we go to the washroom because of this external urethral sphincter, which is voluntary one supplied by S2, S3, S4. If any problem is there in external urethral sphincter, we will lose voluntary control of micturition. It is called urinary incontinence. Until here we have finished posterior urethra, which is proximal part near to urinary bladder. Now coming to distal part, anterior urethra. This distal part of the urethra completely lies within the penis, or in particular entirely in corpus spongiosum of penis. What is corpus spongiosum? It is nothing but a cylindrical erectile structure of penis. It maintains patency of urethra during ejaculation. Here this corpus spongiosum is enlarged proximally to form bulb of penis at the root of penis. This bulb of penis is surrounded by bulbospongiosus muscle. Coming to parts of anterior urethra, which is nothing but distal parts. I already told you it is present entirely in the penis. In the penis, according to the area, it is given names. From the name itself, we can conclude bulbar urethra lies entirely within the bulb of penis, surrounded by bulbospongiosus muscle, into which bulbourethral gland opens. Bulbourethral gland also known as Cowper's gland. Next part of urethra, penile urethra or spongy urethra. Here by name we can conclude that penile urethra lies completely within the visible part of the penis, that is body or shaft of penis or glans penis. How glans penis is formed? It is also formed by corpus spongiosum only, enlarged part of corpus spongiosum. Here it is not proximal, it is distal enlarged part of corpus spongiosum. Ends as external urethral orifice at the tip of the glans penis. This external urethral orifice is vertical slit-like. Here cross section of body or shaft of penis, corpus spongiosum urethra is transverse slit-like. In glans and external urethral orifice, it is vertical slit-like. What is the narrowest part of the urethra? Nothing but external urethral orifice. Penile urethra is dilated in glands called as navicular fossa. Multiple urethral glands, also known as Litter's glands, opens into penile urethra, which are nothing but mucus secreting glands present in submucosa of urethra. Coming to arterial supply of urethra. For posterior urethra, it is inferior vesical artery. The word vesicle means it is related to urinary bladder. What is the part nearest to urinary bladder? Nothing but posterior urethra, supplied by inferior vesical artery. Coming to distal anterior part of urethra, bulbourethral artery, penile, dorsal artery of penis. These both are branches of internal pudendal artery. Both internal pudendal artery, inferior vesical artery are branches of internal iliac artery. Ultimately, the blood supply is from branches of internal iliac artery. In females, it is same as internal vesical artery for proximal part, internal pudendal artery and vaginal artery from distal part of the urethra. Ultimately to same internal iliac artery. Venous drainage for female follows the same. Inferior vesical vein, internal pudendal vein, ultimately draining to internal iliac vein. Whereas in males, internal pudendal vein drains anterior part of the urethra, that is distal part, and then it drains to prostatic venous plexus. Here posterior part of urethra drains directly to prostatic venous plexus. Finally, they both will drain into internal iliac vein. Here this prostatic venous plexus also communicates to valvulus venous plexus called Bateson's venous plexus of vertebra. Hence, any cancer to prostate can easily metastasize to vertebra through Bateson's valvulus venous plexus. Then lymphatic drainage, same. Anterior urethra drains to superficial and deep inguinal lymph nodes, which drains to internal iliac lymph node. Posterior part of urethra drains directly to internal iliac lymph nodes. Now, in a summary, arterial supply is through branches of internal iliac artery. Venous drainage is through branches of internal iliac vein, not branches, tributaries of internal iliac vein. Lymphatic drainage is through internal iliac lymph node. What is the lining epithelium of urethra? For posterior urethra near to the bladder, same like bladder, transitional epithelium are known as urothelium. For anterior distal part, It is pseudostratified columnar epithelium. Mainly the epithelium is pseudostratified columnar epithelium. At the end, external urethral orifice, same like skin, stratified squamous epithelium, which is near to bladder, same like bladder, which is near to skin, same like skin. In between, pseudostratified columnar epithelium. In exactly until verumontanum, it is urothelium or transitional epithelium. After verumontanum, it is pseudostratified columnar epithelium. Except at external urethral orifice, it is stratified squamous. We'll revise the entire structure of urethra, whatever we have learned, in a minute. First, it is divided into two parts. Here, with blue line, I have divided this urethra into two parts. Nothing but posterior proximal nearest to urinary bladder, anterior distal part. First we will see posterior urethra, which is proximal to bladder. Bladder empties urine first to pre-prostatic urethra, which is covered by or surrounded by this green color structure, which you can see. Nothing but internal urethral sphincter surrounding pre-prostatic urethra. Then coming to prostatic urethra. Here this orange color one is prostate. Here the posterior wall of urethra has a midline structure. I have drawn in blue color. This is nothing but urethral crest. On either side of the crest, depressions are nothing but prostatic sinus. You can see all the prostatic ducts are opening into this prostatic sinus. Then on an elevation on the crest, this pink colored one is nothing but verumontanum or colliculi seminalis. Verumontanum or colliculi seminalis. Next, post-prostatic urethra. Again with green color I have drawn that, covered with external urethral sphincter. Passing through perineal membrane, hence it is called membranous urethra also. Three structures: pre-prostatic urethra, prostatic urethra, post-prostatic urethra or membranous urethra. Coming to anterior urethra. Already I told you it is lying entirely in the penis, particularly in corpus spongiosum. There are three cylindrical erectile structures in penis. One is corpus spongiosum, in which urethra passes. Other one, paired structure called corpora cavernosa. This corpus spongiosum at the proximal most part at the root of the penis, which we can't see, it forms an enlargement called bulb. This is bulb of penis. Urethra inside this is called bulbar urethra. Here at the root of penis, corpora cavernosa divides from each other and forms crura, which attaches to pelvic bones. Next, this is shaft of penis or body of penis. This is glans penis. Glans penis is also formed by corpus spongiosum only. This is distal dilatation. Bulb is nothing but proximal dilatation of corpus spongiosum only. Here you can see enlargement in glans, urethral enlargement, fossa navicularis. Entire body, shaft of penis and glans penis has urethra called penile urethra or spongy urethra. Corpora cavernosa ends before glans and it gets incorporated into glands through its tapering ends. This ridge or border of glands where it meets the shaft of the penis is called corona of glands. There I have already told you male urethra is double curved. Here you can see the first curve and here you can see the second curve. Remember my channel name, The Average Derma Doc. Don't forget to subscribe and share my channel. Thank you. Hasta la vista. До свидания.